Palliative care, I think, is the new frontier of what is in the continuum of care.
It is a specialty of medicine that prizes family meetings and communication.
We've been engaged for about the last 5 years in trying to help family members, elders, and physicians distinguish palliative care from hospice care. Most people define hospice care as knowing your death is coming and anticipating that that is within the next 12 to 18 months. And so you organize around meeting that time and living the best that you can live.
Palliative care is much bigger than that. It does not require a prognosis of months. It requires a desire to have a particular approach to care. So people on palliative care may have a longer prognosis.
Palliative care is a choice to no longer continue active treatment on identified conditions.
Palliative care offers so many benefits. For us, palliation is about reaching that place of peace and healing emotionally and in family relationships, other relationships, before they pass to God.
Every one of us, we want to have a very good life. And I think palliative care and that conversation and those decisions really allow that good life that you have elected to live continue throughout, and that's what we're about.
And really caring for the patient and caring for the person instead of trying to cure the disease, more so managing the symptoms and making them comfortable.
And being compassionate and providing them with whatever they need in their journey.
So palliative care is understanding that and appreciating that often as it relates to taking medications or receiving treatment, less can really be best.
I think misconceptions about palliative care means that someone is in the act of dying process, and that's not at all what it means. It really means about being supportive to someone wherever they are in their disease process, and that support can include spiritual support, emotional, of course, pain control, but it does not necessarily mean that someone is actively dying.
So I think probably the biggest misconception is that they're going to expedite the process. And some of our residents have been in palliation for months. It just means that we're not going for a cure anymore, that that process would be harder on them than just letting the natural process take place.
So palliative care is really taking the time to sit back, be deliberate, be intentional about what are those choices around my relationships with my medical care provider, and I like to think it's really being in charge.